Thanks, Neil. What fun. As I was mentioning to Dr. Haniaki, that if I'd have realized that there was going to be forums like this, I'd have taken way better notes through the years. And Okie schmokie. Can you hear me? Coming out? Just a couple of 32 acknowledgments. Some of my great mentors are in the room here, and I can't, of course, everybody's acknowledged Gary Gordon. And I remember 1975, I was in Mill Valley at the time, California. And he drives up with probably Harold Harper or his brother Ross. These are people that started ACAM in 73, I believe. And Bob Vance, Harold Harper. Harold Harper died almost in our arms in 1984. And Harold Harper was a wonderful guy. He had a great practice in North Hollywood, California. It was always so sweet to us during a lot of the early days of orthomolecular medicine, I think as we called it then. And he'd had several heart attacks. And the only thing that was keeping him going was chelation therapy. And he was renowned for driving down the Hollywood freeways with an IV pole sticking out his sunroof, dripping chelation. and he lived quite some time longer. Then he started a thing called WellCorp in Reno. And he was brought up to be the head of it. And he, of course, a big pipe smoker. I don't know why I'm telling you the story. But great guy, all comes back. And so he had a brand new house west of town. He put brand new rugs in with all that formaldehyde outgassing. And he loved to be down on that rug smoking his pipe. And then he had another great big MI and went into the hospital, and he knew he was allergic to morphine. And he let him give him a big whack of morphine, and he just did die. Bless his soul. Wonderful guy. And Ross Gordon, Gary's brother, another phenomenal human being from the East Bay in San Francisco East Bay. In Albany, wasn't it? I believe it was. So, great folks. And another person, again, is Ed McDonough. Been seeing Ed since the early 70s. And I do recall my very first vitamin C drip was his recipe. I think I either called him up or he faxed me or I just wrote it down, 25 grams of C and 2 cc's of B6 and B5 and a little calcium, a little magnesium, a little folic and B12. And I got my very first recipe from Ed McDonough. And I think I still use the same thing. We beef it up with a little bit more C from time to time. And so, having said that, another a great hero, and again, some of the material I want to go over today has been covered by, and obviously by the researcher Ki Chen. And as I was going through a little the recent IVC and cancer, and her work is so exciting, but I will revisit that a little bit. And I do like to again pay honor to Linus Pauling, and Dr. Pauling, of course. Developed the term, or coined the term orthomolecular medicine, as you may know, in 1968. And he and his wife would always say, come in chorus together, now that means the right molecules in the right place at the right time. And orthomolecular is quite a buzzword, still is. And I was president of the Orthomolecular Medical Association back in '83. And so we used to get to entertain Dr. Pauling quite a little bit, and then we got to be bigger friends. And I don't know if anybody ever got to shake Dr. Pauling's hand, but he was always ice cold, and he had on always a 3-piece blue serge suit, in the middle of summer, and he was always icy cold. And we started talking, and I said, I think thyroid is just really great stuff. He says, I think you're right. I could use a little bit of thyroid. And so I was fortunate enough to be able to prescribe thyroid for him until his passing. Remember one day, he was also, a molecular physicist and chemist. And in the early 90s, he came up to Reno, Nevada, to University of Nevada, Reno. And every year, he would put in a paper on nuclear packing equations. And he filled a 40-foot blackboard in about an hour and 20 minutes, left to right, with these nuclear packing equations and constants like this. And he didn't stop for about an hour and a half. And at the end of that, all of the graduate students and the staff just got up and just wild applause. He had so much in him besides. We also tried to get him to talk about X-ray crystallography. He'd speak to the orthomolecular groups and start in with vitamin C and the common cold. Well, and I know that we could have less colds if we all had, and I said, Dr. Pauling, please, we've given it to us, like 6 times. Tell us about X-ray crystallography in the 1930s and how you discovered all those bond angles that Watson and Crick went on to get the Nobel Prize for discovering DNA. And I always wonder, I don't know why I'm digressing, but I always wonder why he didn't get it. And he was such a deductive, logical scientist that I think maybe he just didn't get the visual component of that alpha helix. Now, that's pretty awful, but he just maybe it didn't hit him visually because he's such a reductive logistics guy and scientist. But here we are, and thankfully for him and the work of all of our predecessors. Also, just to say again, thanks to Neil Reardon. Neil and Hugh and I and Inga and about 7 other doctors and couples were invited to Japan, and I think it was '99, for the KYB Association, which is Know Your Body. And the doctor that ran it, they had 35,000 people in a multi-level marketing plan and 35 medical clinics that all has to do with orthomolecular nutritional medicine. And the reason they did it, one of the reasons they did it, besides good medicine, is because in Japan it's still very difficult to get large doses of vitamins and nutrients, as it is in Germany, in France, and hello Codex. And but that was, we had a great, absolutely fabulous trip with those guys. And this is wonderful being here. Last time I was here, I think, was in the mid-1960s when I was in a R&B band playing further down on Hillside. But so it's good to be back to Wichita. Well, IV vitamin C and cancer. Over the years, we've had some phenomenal luck with just good old high-dose vitamin C. And let's see if I can figure out how to advance this. I know this is this the machine or is it the mouse?
Just push the...
Okay, good. Well, by gosh, here's Ki Chen, and who's talked to you already today. And I think the point's probably been made quite sufficiently, although I thought we'd hit it again for those people that were new to the vitamin C story, about the extracellular exposure of cancer cells to vitamin C, and of course going through the states of DHA, dehydroascorbic acid, and then in conjunction with some extracellular matrix proteins that is converted to peroxide. And so then the famous antioxidant vitamin C becomes the pro-oxidant peroxide, and this seems to be completely linked to cancer cell death without any harming of normal human cells. And this is what Ki Chen has told us today earlier. And it's, I think, important for us to remember that it is a pro-drug. This is a study done by Pollard et al. In 2010, showing us that the implanted prostate cancer adenoma cells in rats had a very, very terrific response to intraperitoneal dosage of ascorbic acid. And the tumor weights and metastases were counted at the end of the 40-day experimental period. The primary tumors were found to be significantly reduced in weight. In addition, subpleural lung metastases were even more profoundly reduced in number and size. Grossly enlarged ipsilateral lymph node metastases declined from 7 of 15 rats to 1 of 15. Their conclusion that pharmacological doses of ascorbic acid suppresses tumor growth and metastases in hormone refractory prostate cancer. So all this is very, very exciting news. There's The pancreas also seems to be responding. And in this study by Wan Du that was in Clinical Research in 2010, they thought that, again, the ascorbate concentrations achievable with IV dosing would be cytotoxic in pancreatic cancer, for which the 5-year survival is less than 3%. There was a time and dose-dependent increase in measured peroxide produced with increased concentration of ascorbate, and ascorbate decreased viability in all pancreatic cancer cell lines and had no effect on immortalized pancreatic ductal epithelial cell lines. Ascorbate decreased clonogenic survival of the pancreatic cancer cell lines, which was reversed by treatment of the cells with scavengers of peroxide. Treatment with ascorbate induced a calf space independent cell death that was associated with autophagy, and once again had a good remission in pancreatic tumor lines. Now, this is a local story here, and I'm sure this has been presented either last year or today or tomorrow. But the Reardon Clinic here, and I didn't go through all of the studies, but they had 3 very phenomenal responses in 3 cases to the intravenous vitamin C dosages from 50 to 100 grams given intravenously. And they examined with clinical details of each case in accordance with the National Cancer Institute Best Case Series guidelines. Tumor pathology was verified by pathologists at the National Cancer Institute who were unaware of diagnoses or treatment. So they found that high-dose intravenous vitamin C therapy in cancer treatment should be reassessed. One of the other things I haven't heard today, and Gary hit so many of the toxicity issues that surround, why did we get here in the first place? And cancer, truly is a systemic illness. And if you can't fix the body chemistry on mind, body, spirit, as many levels as you can get at it, then you're going to have a tough sledding. And even with such a wonderful therapy as vitamin C, if people are terribly conflicted about their life and where they're going and the stresses and losses and spouses and losses and kids, and it can be very daunting with even the very best therapies if you can't heal a little bit of the soul as well as the body chemistry. But one of the areas that I think that everybody knows about in this room, I hope, how many people know about NICOs? So not everybody. NICOs are neuralgia-inducing cavitational osteonecrosis, of course. And by this we mean the infections under root canal teeth or under teeth that have been improperly excised. German biological dentistry has a huge jump on regular dentistry, both in materials and methods, and is much more sophisticated. And I'm sure you've seen all the teeth charts where all the teeth are related to distant organs in the body, as well as acupuncture meridians and vertebral columns, vertebral segments, as well as hormones and sinuses and bones and muscle groups. And these lesions produce some of the most toxic bacterial infectious toxins known to man, and a lot of them are sulfur-induced. And a lot of these guys are also surrounded, by these the field of mucus that these guys float in, and so the body's white blood cells really can't find them. So they put out these toxins, thioethers and other sulfur toxins, and they poison and reduce the effectiveness of P53 proteins and P21 proteins, and are very pro-carcinogenic. So a good cancer workup, or a good workup of anybody for that matter, you got to take a good look at their mouth. If they have 12 or 15 silver mercury amalgam fillings in there, you know this person's mercury toxic, especially when the mercury fillings butt gold and they make batteries, and that mercury's coming off at a huge rate. If you've never educated yourself about these dental lesions, it's really a good idea. And a lot of times people don't get better until these lesions are cleaned out surgically. when you go in to clean these lesions out under these frequently badly done root canal teeth, but even well done root canal teeth, the whole dynamic of the tooth changes, and it starts pulling toxins into the tooth, and you get chronic infections in the little 2 miles of canals in the tooth. And so when these guys are infected, and the only way to do that is to do surgery and take a flap back of the maxilla or mandible. And when you start doing the surgery in the bone, you would expect to see white bleeding bone, but it's not. It's gray and it's brown and it's soft and it's mushy, and you can lift it out with a surgical spoon, and has yellow oil surfaces and comes to the top. So this stuff is incredibly toxic, and it's just one of those areas that you need to think about, besides, you know, heavy metals, volatile organic hydrocarbons, plastics, industrial waste, you know, all these other toxins that interfere with the proper functioning of our immune system. So we've had very personal experience with many patients and family members who have had very serious neurological problems that have been completely solved by getting their surgically removing their cavitations. So it's something to think about when the person's sitting in front of you with when your patient's sitting there with a terrific lifestyle, and they've been eating organically, and they're exercising, and they're sweating, and they've been working on their chelation, and they still have a big old cancer in their body. Do check their teeth. It's dreadfully important, and there's not nearly enough dentists around that do this kind of thing to take these teeth out. And we always like to thank Dr. Michael Margolis in Mesa, Arizona, who helped our family quite a lot. And I don't know, I can tell my wife's story, I guess. She was about 12 years ago, 15 years ago, she was having horrible problems remembering, and then she would have the left side of her body would go completely numb, and her vision would gray out. It all was brown and gray, and she couldn't see. And she had absolutely perfect laboratory tests and chemistry tests, and all of the x-ray studies of the teeth were completely normal. And and blood pressure, vital signs, everything is terrifically normal. So we met Michael Margolis at an IABDM. I think there was no M at the time. Now there is. The International Academy of Biological Dentistry and Medicine, which I encourage you guys all to be aware of, the tooth connection, the teeth connection. So we went down to Mesa at the behest of another dentist friend of ours, and he took some Cavitat studies. How many people heard of Cavitat? Great, super. Well, it's an ultrasound device that determines the density of the bone, and if the bone is very, very soft, frequently there's infection underneath it. And so here we did the Cavitat, lots of infection, and my wife at that time was so bad that she didn't remember the name of her children, you know. And Inga's pretty hot gal, as you know. And so during the surgery, and my big boy, who's now about 35, was holding on to her arms. I was holding on to her feet. And when you start taking all this mushy bone and infected bone out, she really felt like the angel of death was leaving her body, and her vital signs changed, and her color in her face changed right on the spot. And that's been 12, 15 years. And like a lot of things, teeth are an ongoing battle, and but if you, it's a nice way to evaluate your patients, just to make sure that their teeth are not killing them. The Bob Jones, who invented the Cavitat, he is an engineer from, I think, Boulder, Colorado, is no longer making them because of being hassled by major insurance companies. And so finding dentists that can help you in these departments is not always easy, but the IABDM is certainly one of a great group. Well, looking at kind of the sad side of things here just a little bit, I'm not sure how we got here, but in this article by Hoffer in the Annals of Oncology in 2008, they decided that they would check this ascorbic acid business out, and and noted that it was selectively cytotoxic to many cancer cell lines. and has in vivo anti-cancer activity when administered alone or together with other agents. And they carried out a dose-finding phase 1 with ascorbic acid. So the patients with advanced cancer or hematologic malignancy were assigned to sequential cohorts and infused with 0.4, 0.6, 0.9, and 1.5 grams of ascorbate per kilogram body weight 3 times weekly. All patients had at least one and most multiple aggressive chemotherapy and/or radiation interventions. Actually, I added that. I mean, you can glean that from the paper. But the adverse events and toxicity were minimal at all dose levels, and no patient had an objective anti-cancer response. So I don't know where that comes from. I do know that people that I know that also do IPT with chemo do say, and include vitamin C in their program, do say that virgin cancer patients are always easier than if you have somebody that's been worked over by radiation and chemotherapy, and their energy is very low, and their reserve of chi was very, very low. So they do say that the promise of this approach may lie in combination with cytotoxic and other redox active molecules. And again, that's what we're hearing from Dr. Weeks today. That's the combination of things that can give sometimes more magic. So again, here's Qi Chen again, when she has given you all these today, but has shown that the mice bearing glioblastomas xenografts showed that a single pharmacologic dose of ascorbate produced sustained ascorbate radical and hydrogen peroxide formation selectively within interstitial fluids of tumors, but not in blood. Moreover, a regimen of daily pharmacological ascorbate treatment significantly decreased growth rates of ovarian, pancreatic, and glioblastoma tumors established in mice. Similar pharmacologic concentrations were readily achieved in humans giving ascorbate intravenously. These data suggest that ascorbate as a prodrug may have benefits in cancers with poor prognosis and limited therapeutic options. And very fortunate to have Qi Chen here today, and I'm sorry I had to miss her show this morning, just getting it on the plane. But we'll be reading all of her results and looking forward to great new stuff in the future. Now, one of the other wheezes of our oncology buddies is that don't give vitamins or nutrients with radiation or chemotherapy treatments, because the antioxidant effects could be very dampening on the outcome and mess up their chemotherapy, and so pull all of our patients off all their nutrients, which makes them totally more vulnerable to the toxicity of these poisonous drugs, especially given in large doses over a long period of time. So I thought it was interesting in this paper by Dr. Block et al. Integrative Cancer Therapy in 2005. And I had not heard of this drug before, but amifostine, it's a pharmacological antioxidant used as a cytoprotective in cancer chemotherapy and radiotherapy. Once again, if you can patent it and you can make some money on it, then somebody's going to use it. So good old vitamin C and the other antioxidants that we love, of course, don't make a ton of money for people. So it is thought to protect normal tissues relative to tumor tissue against oxidative damage inflicted by cancer therapies by becoming concentrated at higher levels in normal tissues. The degree to which amifostine nevertheless accumulates in tumors and protects them against cancer therapies has been debated. Guidelines have been published that direct its use in chemotherapy and radiation, taking into consideration the concerns of tumor protection. In this article, clinical studies of amifostine appear since the publication of the most recent set of guidelines are reviewed. So basically they found that it protected against chemoradiation, and that it's still being somewhat debated whether it protects tumors. But no evidence of tumor protection was observed. So amifostine may enable populations unable to tolerate conventional cancer therapy to receive treatment for their cancers, even if some degree of tumor protection is eventually discovered. The authors discuss the implications. So I thought that's interesting that that pharmaceutical, big pharma, has come up with antioxidant materials to protect patients during chemotherapy, and yet still it's very widely counseled by them to stop all nutrients, stop all vitamins and supplements and minerals that they're taking. This is a dear friend of ours, And unfortunately, I had not gotten to work with him in the previous 3 years. He had a horse step on his foot, and then the lesion gradually turned black. And then there were some other little black lesions around the first little black lesions. And then they started moving up his leg. And then I think he did Gerson mostly therapy at that time. How many know Gerson? Yeah. How many guys do coffee enemas? Hey. So yeah, coffee enemas are always one of the most interesting things to tell your patients about. And but it's the xanthine oxidase, which is a C450 enzyme. And so the coffee contains caffeine, theophylline, and theobromine, which go right up into the liver via the portal veins, go bam, right into the liver, and turn on bile formation of the liver and detox the liver from many different poisons. And also, of course, during that process, the enzyme throws off free radicals. So people debate about, of course, peroxide obviously forming free radicals. But coffee also can form these free radicals, and this is another means of destroying cancer patients. And we know the Gersons, quite well over the years. Is Charlotte still cranking? Oh my God, she must be 90-something. Got to be. Charlotte Gerson Strauss. I think we visited down there in '75 as well. Max Gerson came to the United States. I think he went to Atlanta first, and he was mainly interested in tuberculosis with coffee enemas, and then he found that it worked great on cancer patients. And his clinic in Tijuana would have people do 5 a day, 13 juices, vegetarian diet, organic calf's liver in carrot juice, yum. And but he would do 5 coffee enemas a day, and the motel structure was just basically people hanging out doing coffee enemas and having high fevers, and their immune systems seemed to really be boosted up a lot by it. But it certainly is wonderful for cancer patients, and especially for pain. I remember another patient who was a executive vice president at one of our large casinos in town, and was diagnosed with colon cancer, and I think he had some liver mets, and his GI doc said, "You've got about 3 months." And I think, by the way, I think giving somebody a death sentence is just the most horrific thing that anybody could do. The self-fulfilling prophecy of doctors doing that to people. They all should be strung up and shot and said, yep, 3 months to live, that's it, get your affairs in order. And so 3 months to live. He says, now you go to Hawaii for about 6 weeks, then you come back, get your affairs in order, and that'll be all she wrote. So it turned out that it was our Tiffany's husband. And so a very motivated wife got involved. We started giving him IV vitamin C drips with coffee enemas, and he passed nearly 4 years later, completely out of pain, great quality of life. He was only in pain the last day or 2 of his life. And that was one of the very first times we said, oh my heavenly days. Matter of fact, they went to Cancer Treatment Centers of America in Tulsa, and they were nice enough. They called me and said, "Doc, give me your IBC formula, will you?" And they used it right in the hospital. Well, one of our very good buddies was a 61-year-old male dentist, and after the horse stepped on him, the melanoma took off, and so he then developed brain metastases. And I think he was down in Southern California seeing another practitioner at the time, but he was in such bad shape and seizuring and obtunded that they took him to Loma Linda. And basically they said, this is all she wrote, and take him home, get the hospice going. And so he landed back on our watch, and after giving him 50 and 100 gram IVC infusions with DMSO, I think we used a little salicinium with him, which is called Altolase. It's a glycobenzaldehyde that you may hear about in coming years. And we think that it does have promise, and we can talk more about it as time goes on. But he regained consciousness, normal lifestyle, happy, joking, eating, walking, sleeping, and as you know, vitamin C is a terrific way to reduce intracranial pressure. Do you guys all know that? Yeah, it is. And that along with a little dexamethasone. But he did very, very well. As a matter of fact, he did so well that he went across town to another practitioner where they put some dyes in his blood and a large laser to the brain to kill these tumors, and unfortunately had a very negative response to it and started to decline quite rapidly. But he died about 3 months later. But everybody that participated in his care felt that his initial transformation and greatly improved quality of life was amazing. And we have seen this a lot of times with intravenous vitamin C. A paper that I just came across the other day, and this is a real old one back 1980 from Nature, that struck me that the aim of the study was to show that vitamin C is selectively toxic to at least one type of malignant cell, a melanoma, at concentrations that might be attained in humans. And in copper ions, which are high in melanoma, and as you may know, copper can be a metallic cofactor for manufacturing peroxide, and that this tumor may assist this peroxide manufacturing. So ascorbate, when combined with copper, rapidly reduces the viscosity of DNA solutions and has exhibited some carcinostatic effects on transplanted sarcoma 180 tumors in mice. We reasoned that the elevated copper concentration in melanoma could result in a more selective toxicity for ascorbate. And I wonder if that's not true. And we have had some decent longevity in melanoma patients over the years. And I don't know if you have been exposed to this article, but and this has gone back quite some time, but they found that K3 administered in humans also produced peroxide, and that K3 along with ascorbate, you could markedly reduce the dose of both substances and still have a very powerful oxidative and cancer-killing therapy. The synergistic inhibition of cell growth at 10 to 50 times lower concentrations. And again, these are not toxic to humans, and the combination of sodium ascorbate and vitamin K3 may also prevent metastases. So we've started adding that in. How many people use K3 with their, anybody have any, we'll talk about this maybe in the panel, but I'd be very interested if anybody's seen any toxicity or negative effects with the K3 added. Anybody see any toxicity? Well, we'll love to hear about it. So they're calling it Gilotto. Looked at this in 2004, and they seem to feel that the K3, the autoschisis, novel type of cell death characterized by exaggerated cell membrane damage and progressive loss of cell contents. During this process, the nucleus becomes smaller, cell size decreases 1/2 to 1/3 of its original size. Co-administration of sodium ascorbate and K3 induces a cell cycle block on cancer cells, making it harder for them to grow and divide. This is called a G1S block. The intravenous vitamin cocktail containing sodium ascorbate and vitamin K3 diminishes cancer cell DNA synthesis, increases peroxide production, and decreases cancer cell intracellular antioxidant defenses. So I'll be very interested to hear other people's experience with that during the question and answer session. Another dear friend, who was the wife of a dean at Indiana University, that's a many year friend, was diagnosed with ovarian cancer and treated initially with hysterectomy and cisplatin, and had a recurrence. And since they were our buddies, they flew out to Reno and was recommended to our clinic for nutritional support. So we got her going on Wobenzymes and coffee enemas and fresh juices and organic foods, and so also with vitamin C infusions of 25 to 50 grams. And it was just even once a week, I believe. And these were administered, of all things, by her oncologist in Bloomington, Indiana. And she lived about 10 more years and had an excellent quality of life. And the oncologist was so blown away with the results, he said, hey, I'll do that. You know, she didn't have to go out to Reno. I'll do that. You know, she didn't have to do her own IV. And so that was one of our most notable longevity cases using intravenous vitamin C. And you know, subsequently we've had other people from Utah. There's one gal with a breast and lung cancer who had some chemotherapy, and she and her family did her own IVs. We'd send them into the middle, Fruitvale, Utah, just middle of nowhere, and they did their own IVs, and she lived for 7 years with advanced breast and lung metastases. And that was, she'd call up and I go, my goodness sakes, you're still here, you know. Now, we've done this many a time, but again, this is one of our great patients. And she is a 52-year-old female with breast cancer who's undergoing chemotherapy with, I believe, our buddy across town with adriamycin. And she had a very toxic reaction to the chemotherapy. And of course, as you know, it's quite cardiotoxic. And so she was having chest pain, short of breath, bilateral arousal, ankle swelling, hypertension, a gallop, and severe anxiety. And she walked in and said, "Doctor, I'm dying. I'm dying." After 2 consecutive days of 50-gram IVCs and nutrients in the bottle, her heart and acute symptomatology returned to normal. It all went away. A couple days. And we have done that subsequently a number of times. People have been really overdone with their chemotherapy and have been saved by intravenous nutrient therapy and vitamin C in high doses.